So he literally talks about it as a light bulb moment in the middle of the night where he was like, that's what I'm going to do. I'm going to pack up the contents of the GP clinic, put it in the back of my car, and I'm going to go to the homeless services and run a GP clinic.
It's funny how when the camera is on and I know it, I feel very conscious about it suddenly. Does that happen to you? Welcome to the first episode of the Impact Podcast. It's hosted by Homeless Healthcare. Today we have Alison Sayer, who is the CEO of Homeless Healthcare. The main idea is to have a conversation and not an interview. So, Alison, if you don't mind introducing yourself and letting us know what you do and how things are. How are you today?
I'm well, thank you. So as noted, I'm the CEO of Homeless Healthcare. I became involved in the organisation because it was actually my brother, Dr. Andrew Davies, who founded the organisation back in 2008.
Mm-hmm.
I am basically responsible for the operations of the business and also making sure that we get all the funding that we need to run the organisation.
Mm-hmm.
And that's from a variety of different sources. So we get some government funding, but we also rely quite heavily on philanthropic funding and also donations from the public as well, because the money that we get from government isn't quite enough to run all of our different services and doesn't quite fill the need.
Mm-hmm.
And I report to the board of directors. There's a board of directors that oversees the organisation, and so I report to them every couple of months at the board meetings.
So one thing I wanted to understand is that when you say that the organization has been started by your brother, is there any thought behind that as to why suddenly he felt the need to, contribute towards a cause where, he wants to solve problems for people experiencing homelessness and, healthcare issues for people primarily experiencing homelessness? What is the background story?
The why? Yes. So he did medicine and originally was going to be a specialist because he thought that that's what he should do, and trained in pediatrics for a while, which is doctor for children, but really decided that that wasn't something that fulfilled him and went on to do a general practice training. His first placement that he got as a general practitioner was out in Midland, and he had grown up in the western suburbs of Perth, which is a wealthy part of Perth, and Midland is not so wealthy, and there's a very high number of Indigenous people who live in that area, and all of a sudden he was exposed to people who were struggling to even have a roof over their head and also had lots of really complex health issues. And the doctor that he was working for in Midland said, you should go and work for Street Doctor because you seem to like the mental health and the drug and alcohol side of things. And Street Doctor was an organisation at the time that had vans, and they went out in the evenings and had GPs, and they would basically sort of patch people up. So it's a little bit like having a mobile ED department. And he did that for a couple of years and became increasingly frustrated because he was seeing the same people all the time, and he just felt like he was patching them up, not improving their health in any way. And it very quickly dawned on him that you couldn't improve their health if you didn't improve their housing situation. So in order to have any effect, you would have to work alongside a housing provider or social services while you're also addressing their health. So he literally talks about it as a light bulb moment in the middle of the night where he was like, that's what I'm going to do. I'm going to pack up the contents of the GP clinic, put it in the back of my car, and I'm going to go to the homeless services and run a GP clinic inside, like the drop-in centres, so where people experiencing homelessness will go to in the morning to have a shower and have a feed, because he felt that if they were fed and if they had had a shower and felt a little bit safer, they'd be much more open to addressing all their healthcare needs and having a conversation about it, rather than just being in this very high state of crisis. So that's pretty much how it started.
And this started back in 2000, which year?
2008. And it started with 2 half-day clinics. So he did 2 half-day clinics and thought that that would be it. But very quickly, the demand for having, GPs within homelessness services became very apparent. And it very quickly grew to 10 clinics and then now 14 clinics a week that we do. And that's just one part of the service now.
Okay, so what all does the homeless healthcare organization do in general? Like, I know that they provide healthcare services to homeless people experiencing homelessness, but like, if you were to quantify as to how many clinics do you have and how many GPs are currently working with us, and how many like, what is the quantum of number of patients that visit us, and also I wanted to shed a light on one of the topic is that are people very open to approaching healthcare facilities? People experiencing such harsh conditions, are they open to coming and taking benefit of our services?
Yeah, well, yes and no. So often, and another whole reason we exist is to try and break down some of those barriers to healthcare. So what typically happens with people who are homeless is that they're so busy trying to find somewhere that's safe to sleep, something to eat. Their needs, their hierarchy of needs is very much the shelter, food, and healthcare falls very low on their list of priorities. So what often happens is they ignore their health and end up getting really very unwell and end up in the emergency departments. And then very often, because the emergency departments are very busy and they'll be in a state of crisis, potentially not behaving particularly well, they're smelly, they look dishevelled, they don't get treated particularly well on the whole in the emergency department. So they will get discharged very quickly back onto the street, and then that cycle just keeps happening. They just get more unwell and end up in and out of the emergency departments. So one of the main reasons we exist is to intervene before that happens and provide primary care, which is what general practitioners do. So provide primary care in a whole different manner of ways to try and stop people ending up in the emergency departments. And then also, while we're providing that care, we work on all their social issues as well. So, are they linked up with Centrelink to get some payments? Do they have a housing application in for somewhere? Are there legal issues that they need to get sorted out? So just trying to work on all those psychosocial issues at the same time that we're addressing their health care. So to answer your question, often there's a lot of distrust around healthcare providers, and our street outreach nurses who literally go out and walk the city streets and look in behind buildings and find people wherever they are. A lot of what they do is just about engaging with people and trying to build rapport and get them to trust healthcare workers again, because often they don't trust them very much. So once they've developed that trust, then they can sort of link them in with our GPs. So yes, on the whole, most people want our services because they usually are quite unwell and do need health services, but sometimes it takes quite a while to develop that trust and get them to engage with what we're doing.
So when this was started by your brother in 2008, it was just one single person who had this thought in his mind. as to do something for the society. How did that lead to an organization that we are today, with so many employees employed at the organization, and how are we able to fund all of this? I'm pretty sure it's the medical expenses, and in general healthcare is expensive in Australia. So how did we manage to sort of be where we are today, in terms of running an organization, employing a lot of employees, and yeah. So is it all funding, or is there any other way that we operate to make this happen?
Well, so we've now got over 70 employees. We've got 8 general practitioners, 3 nurse practitioners, about 30 odd nurses. We've also got caseworkers and support workers that work with us. A lot of it does come down to funding, but to get the funding, there's a lot of advocacy that was needed, and a lot of talking to government and getting them to understand how health and homelessness are linked with each other. Because I think in the early days, they were very much treated very separately, and it still is to an extent today. And early on, when the organisation was very young, we'd end up getting bounced around from the Department of Health to the Department of Communities, because Communities looks after homelessness and Health looks after health. And they would think, oh, well, homelessness is a communities problem, and Communities would be, well, no, health is a health problem. So we would end up getting, no, we won't fund you, go and talk to health. And then health would be like, no, that's a communities issue, go and talk to them. So Andrew has advocated for years and years, and he ended up getting government funding for those pop-up clinics, the mobile clinics. So that was the first bit of government funding that we got.
And when did this happen? In which year did this happen?
That probably was around, I think 2010, when he got the first little bit of funding. Prior to that, he was just basically relying on Medicare billing, so operating like a bulk billing service, and keeping it afloat that way. So it did take a little while, and then that funding sort of expanded as they realised that the demand for more clinics was there. So the number of clinics that we were getting funded for then increased. So that's how we've managed to grow the mobile clinic side of things. And probably the second service that we got up and running was our street health, which is the nurses who go out onto the street and engage with people. And that was through some philanthropic funding. And again, that was about educating the philanthropists around what we were doing and getting their support. And then it's just basically grown from there, and it's taken, and another big piece of the puzzle is we engaged with a university group to evaluate what we were doing, and we collected heaps of data, and we were showing how we were improving people's health. We got the evaluation team got access to the hospital data, and we could show how much we were stopping people from ending up in hospital, and how much that was then costing the health, saving the health department. And having that data and being able to then go to health and say, hey, look at this is what we're doing, this is the other ideas we have as to how that we can do even more, and that's really how the whole service has grown. But lots of not-for-profits, we are always scouring for grants, ways to get funding, because a lot of the funding is quite short-lived. Even government funding, you go with the cycles of who's in government, and then that changes, and then you've got to try and apply, make sure that your funding doesn't stop. So it's very cyclical, and it's just something that you have to always be on top of. Otherwise, all of a sudden, your funding stops and your service stops.
Whatever you said is so. It it definitely feels like a lot of effort. Especially, I can't even imagine how things. I mean, how your brother managed to do things all by himself, and in the early stages of the startup, when there were not many people, around him to support this cause, and there's not enough money to get the organization up and running, but he still persisted and tried to do whatever he can with whatever he had at that point in time. And today, after how many years has it been? 28, 10, 17 years?
17.
17 years. After 17 years, and this is an organization consisting of 70 employees. And we are actively working across Perth to help the society in our own way.
So, and the other big bit of growth that occurred was when we opened up our medical respite centre, which is the residential
MRC
service that we run. But that took 5 years of advocacy to get that up and running.
And when did this start? When did the MRC start?
3.5 years ago.
3.5 years ago. Okay. And it was 5 years of effort prior to the 3.5 years ago.
Yeah, wow. And we had people like the Rotary clubs giving us expertise for putting forward business plans, and it had various different iterations before government sort of got onto it and said, actually, this is something that we need in our sustainable health review. They did a sustainable health review, and a respite centre for people experiencing homelessness ended up being part of that forward plan. And then they put a tender out for service providers to put in a tender to run it.
So over the course of years, what do you think has this issue of ongoing homelessness increased, reduced, or how is it? How is the trend has been since the time you started? Is it getting better?
It's definitely increased. I mean, at the moment, we're supporting around 3,000 people a year, and that has grown, and the number of new people that we've not seen previously is increasing, and I think that's been quite pronounced ever since COVID. I think COVID's really, that period of time has then put a lot of pressure on the housing system with the cost of living. The cost of living has gone up so much, and then the cost of rentals has also gone up exponentially in Perth, and it's just meant there's a whole group of people who can no longer afford to live to rent their homes, and then find themselves homeless for the first time. So that's sort of the wave that we're seeing at the moment. It's taken a few years to sort of become really prominent, but that's what's happening now.
Just a few months ago, I think, and by the end of last year and the beginning of this year, I moved to Perth last year in July in one of the landlord's house. He used to stay with us, and after a point, his family was moving back from Melbourne, and we had to vacate our house immediately with a very short notice. So, and since we are students and I'm still studying here, so we didn't have a lot of rental history built up. I mean, it has only been 6 months, so there was not enough rental history. So when we were trying to look for new house, me and my brothers, we couldn't find a house because of lack of proper rental history, and for which we had to struggle a lot to find a decent house, even though we could afford a house. But still, the market is such that they were only giving out houses to people with a proper rental history. The ones who don't.
They can be really selective now because there's just such a shortage.
Yes.
Yeah.
And
really
there was a brief period. I think it was November 25th or November 24th when our lease was getting over in the previous house, and we had found a house luckily by the end of our lease period. But the new lease was starting on December 7th. So from November 5th till December 7th, there was no place to go. It was me, my brother, and my cousin. We are three students. We don't have any family here. We don't have any anyone like supporting or someone that we could latch on to in such a situation. So I remember like I had to put like bunch of my stuff in the in the boot of the car and we had a couple of cars, and we loaded the luggage in the car, and I went to three of my friends' house, and I put my stuff in their rooms so that I couldn't accommodate everything. And like it was very difficult to manage just for 10 days of that time frame, where there was no place to go. There was no bed. There was no place I could go to and sleep. So most of the times I used to just work or go to uni during the daytime, and at the night time after 12 o'clock I used to sneak into my friend's house and get a nap of like for a couple of hours, and then again come back out, because if the landlord had found out that we used to do that, then it would cause him trouble, because he was not leasing the entire house as well. So it was it's very sweet of him to help during that time, but it was for a brief 10-day period. We didn't have any place to stay. Like there was times when I was just in the car waiting at the McDonald's just for the time to pass. It was I mean I don't want to make it sound like it was too bad. Of course we had friends who were very helping, and we had enough money to afford food and all the basic necessities. I can't even imagine how things might have been for people who don't have enough finances to support themselves, and they are so this happened in the beginning of summer, so the weather was not too bad. But I can't even imagine how things might be in say rainy season, or when the weather is not so supportive of people trying to find a new place to live. So there's this conception that people who experience homelessness are all some sort of addicts. There's a misconception that these people are lazy and they don't work enough for themselves, and that's why they are in the situation that they are. But I'd like to differ from that, as that if you don't have a home, it can happen for many reasons. Like we had enough funds, we had we could afford a house, but we were still not getting a house. So I'm pretty sure that there are so many reasons that people have which might be overlooked by the general society. Have you come across cases like that where people, it was just out of their control? It was not something that they could actively do at that point in time.
Yeah, absolutely. I think, we see it all the time, that it's just this series of really unfortunate circumstances that often lead to people becoming homeless. And one of those things is a health incident, so getting cancer or a mental health break that can then lead people to being homeless, and then also relationship breakdowns or financial, losing their job, or there's a whole range of things that can lead people to become homeless. And I think the humbling thing for all of us that work in the space is that it could really happen to anyone, and people that as well. We think we're so removed from it, but we're really not at all. And we've just had so many different people come through our service that, one lady in particular had a job as a medical receptionist, always been employed. She became ill with breast cancer. She couldn't afford the treatment, or the treatment used up all her finances. Then her tenancy came to an end, and then she simply couldn't find somewhere else to afford to go and live in. And then all of a sudden she not only had breast cancer and was trying to have treatment for that, but was homeless. And that's after a lifetime of not being homeless. So, I think there is a lot of misconception that people want to be homeless or they're not doing enough to get themselves out of their situation, but very often it's their health or mental health that's preventing them from getting out of the predicament that they're in, which I think most people don't stop to consider.
Okay. What is the one thing that if you had to give out a message to society in general, what is the one thing that you would want to say about homelessness and the whole situation? What is the one message that you think people should know?
Well, I'm not sure that it's something people should know, but I think it's really important that I think a society is only as good as its weakest members. Or, there is a saying that, if we don't support our most vulnerable, then really as a society where we've got no strength and we've got no integrity. So, and also people who are much worse off than us, then it just affects all of society. So if we're not willing to help others who are less fortunate than us, it's not just a reflection on ourselves, it actually ends up being a reflection on the whole of society and ends up costing society a lot more money. So it's in everyone's best interest if we look after those who are vulnerable. Yeah.
Yes, and I think one of the points that you said completely makes sense is that if an illness is treated in its beginning stage, it is a lot less expensive than treating it in the later stages when it gets more severe. So
prevention is better than the cure.
Prevention is better than the cure. Exactly. Yeah. And what do you think is the hardest part of your job?
The hardest part, because I think all the staff get exposed to some pretty traumatic things, and they support people who have experienced a lot of trauma generally. And so it's about trying to keep the workplace a positive place and celebrate the wins and just keep the staff really well supported. That's probably one of the more challenging parts, and then also their money. But that's every not-for-profit's complaint, really. Yeah. But it's
so there's this if have you ever seen little babies? If there are two babies beside each other, and if one starts crying and is in a very bad and upsetting mood, after a point, even the other baby, which was smiling and in a better mood, even that starts crying. It's just the transfer of that energy. So I can understand.
We call it vicarious trauma. So
there's a term for that.
When our workers don't actually go through the trauma, but they are exposed to it and they hear it, and so it's called vicarious trauma. Yeah.
So I think there's it takes good amount of time and effort for them to just be detached to the whole story and still work towards helping them. So
really hard if you want to have empathy towards the person. So it's a real and sometimes some stories just resonate more, and some people's situations resonate a lot more strongly, like the staff who have children. If there's something happening to children, they often feel that a lot more. So it is they definitely have to have really strong boundaries to protect themselves, but it can be challenging.
So which is one of the biggest health issues that you often come up noticing, which you notice a lot these days amongst people experiencing homelessness, and does this change according to the seasons, or is it more or less the same in every season? And my perception about this is that people will have a lot more problems in rainy seasons, where when it's raining, when it's compared to summer. But I'm not sure if I'm right on that statement.
Yeah. Look, probably the two biggest issues that we see would be non-seasonal and just pervasive the whole time. So probably 2/3 of the people that we see will have some form of substance use issue, and then 2/3 will also have some sort of mental health issue. And often the substance use is a product of being homeless, like trying to cope with being homeless and the stress of being homeless. So they don't necessarily have a substance use
It's
issue.
like a vicious cycle.
Yeah, it is a vicious cycle. And the mental health side. So, I mean, we've done some research on our own patient cohort, and, you know, depression and anxiety are quite prevalent. But the thing that we feel that is underreported in our patient cohort, but international studies are sort of indicating that, you know, between 80 to 100% of people experiencing homelessness will have post-traumatic stress disorder, either from something traumatic that's happened in their life that then causes homelessness, or actually being homeless and the stress and trauma of that.
I have heard a lot about post-traumatic stress disorder, but I don't quite know what exactly it is. Is it just like stress, regular stress? I mean, I'm so sorry if I'm sounding too naive and, you know, like I don't know.
That's okay. I'm not a clinician, so I probably can't give you the exact terminology, but it's just basically you've been exposed to something really quite traumatic, and then you don't function, and your responses are probably not, you know, appropriate sometimes based on the fact on that trauma. That would be my best way of describing it. I think a lot of people who serve in the military experience post-traumatic stress disorder just purely of what they witnessed, but it's a similar thing, that, you know, your body responds to traumatic events in very strange ways, and it can come out in all sorts of different ways.
The other day I was having a chat with Nat, and she was telling me more about how things were during COVID. So one of the things that she told me is that the people who are sort of addicted to drug usage, because during the COVID everything shut down and all the drugstores and alcohol stores got shut down, so their dependency, so they still had that dependency on that in order to function, and because everything was closed down, so there was no means for, you know, them to access anything, and because of the, you know, the unavailability, their current condition even became more worse. It worsened due to that.
Right.
It's strange to listen to that, because usually we hear that, you know, alcohol is bad for our health, or, you know, using drugs is bad for our health. But when she said that, you know, not using them made their condition worse, it's almost like counterintuitive. It's just like it's contradicting, but it also makes sense in some way, because their dependency on the drugs became so much that, you know, they are unable to function without it, and and
I think if it gets stopped too quickly, particularly if it's all of a sudden they have access to it and then all of a sudden they don't, they go into withdrawal symptoms, which can be really dangerous if it's not managed properly. Particularly alcohol withdrawal can be really dangerous. So I think that's what she's probably talking about.
I heard Nat saying that, you know, sometimes we doctors, or in general health practitioners, prescribe patients to continue their alcohol consumption but slowly reduce it over a period of time and not stop it immediately? Is it because of the same reason that you just stated?
Absolutely. Because if they have a higher dependency and they stop straight away, it's very, very dangerous.
Like, can it lead to some sort of seizures or paralysis?
Seizures, definitely, and even death.
Even death?
Yeah.
Have you experienced so of all these years of experience that you have been working for the homeless healthcare, did you ever encounter a situation which was just too difficult for you to deal with?
I think there's been lots of situations where, and again, not me, I'm not a clinician, but lots of situations where the staff have been overwhelmed with the situation of a person and where to start or how to help them. I think that's, it's not there's no simple solution, because people's health, mental health, their life circumstances can often be very, very complex and codependent on each other, and sort of pulling someone out of a cycle of addiction can be very difficult. Pulling them out of a bad relationship can be difficult, because they feel worthy even in a bad relationship. So there's been so many times that the staff have felt helpless or felt that they could only do so much, and then just had to watch someone deteriorate because they could do no more.
So just to conclude whatever we are discussing, so what is our next 5-year goal or trajectory? Where do you see us going forward, and how do you see things improving? So it's a big question, isn't it?
Yeah, look, I don't think the housing situation is going to improve much over the next 5 years. We're sort of scrambling at the moment to try and provide enough housing for the current population, let alone the growth that's going to occur over even the next 5 years. So I don't think that the homelessness situation is going to improve. I think it's going to at least stay the same or get worse, unfortunately. And for us, so our main areas that we want to expand, and this is based on need, is, so we currently do our street outreach just to the Perth CBD and Fremantle CBD, but we would like to go out further to the other suburbs, because there's definitely a lot more homelessness popping up further out. And then our other area that we really want to expand is our residential support. So I talked about the one residential service that we have,
MRC,
but we've got the MRC. We would love to do a step down from the MRC to another supported accommodation that's less medical but still has all that psychosocial support to get people ready to live in a home, because you need, I think a lot of us take for granted the skills that you need in order to run a household or live in a house and budget your money, do your shopping, keep everything clean, all that sort of stuff. And a lot of people just have never been taught how to live in a home properly. So that's sort of our goal, is to provide more residential services where we can support people to then live successfully in their own home. Because unfortunately what happens, a lot of people get housed, but then they don't have enough support to stay in that home, and then they end up homeless again. So that's another area that we're really wanting to inject some support.
What role do you think businesses and communities can play in order to help the cause of homelessness, tackling homelessness? And how do you think businesses can contribute in their own way to...
I mean, that's a tricky one. And I think it's something that there is this fine line between helping people and then enabling them to stay in the situation that they're in.
Hmm.
So as much as businesses could help support someone by maybe giving them some food or, clothing or whatever, I think we all have to be really mindful that we want to help move people out of homelessness and not keep them in it. So I find that a really tricky question to answer, because I don't think there is a simple solution of what businesses and community can do. I think it's such a complex problem. It needs lots of different agencies within the community to come together and work together at the same time to get people out of homelessness. So we're just really mindful that when we give things out, it's for a particular purpose. So, the street outreach nurses will give beanies and socks in the winter because, a beanie keeps your core body temperature up, and that's really important for your health. And the socks protect you from getting, horrible frost, nasty stuff on your feet, getting gangrenous infections and things on your feet. So we're just really mindful that what we give is to provide direct medical support or direct support, but not keeping people in that homeless space.
Do we have a facility where if for example, I am currently experiencing homelessness, and if I am having severe medical condition, if I'm feeling extremely unwell, do I have any facility where I can just go and say that I'm not feeling well, this is the situation, and I want to get some help, if there is?
Yeah, so the two places would be the drop-in centres with where our clinic is, so engaging there, or I guess if they end up in hospital, we've got a team inside Royal Perth Hospital that would engage with them. So if you turn up at hospital and you don't have an address, if you don't have any fixed address, then our team in hospital will come and see you, and then help direct you to healthcare.
And what areas are those clinics based out on in Perth? Where are they?
Look, most of them are in and around the CBD because that's where most of the homeless services are. But we've also in some of the drug and alcohol communities, and one of them's in Gosnells, and so there's a few around, and then we've also got a couple of clinics in Fremantle as well.
Is there anywhere the general public can go and look it up if someone sees someone who is experiencing harsh conditions, if they want to help them? Is there any way general public can contact us and let us know that such a situation is happening, as sort of like an alert system or something?
Well, I mean, they can go to our website and then just ring the number, our phone number, and talk to reception. We get quite a lot of phone calls from various people in the community, and we can help and direct them as we, the best way that we can. So that's probably the best way.
I think this podcast is also one of the efforts in that direction, is to make a lot more people aware. I feel society in general, people in general are helping and they are caring. It's just that they don't know that this problem is such a big problem, and they don't know that there is an organization which is trying to solve this, which is trying to help people. I think awareness is the second thing. The more and more people get aware of problems and situations like this, the more they get to know the story and how things work. And I feel a lot more people will be able to sort of connect and will be willing to help our cause. So that's a couple of things which I think will help us in the long run, and we hope to keep doing this. It's the beginning of something, and I feel it can serve a great purpose if we just keep at it. Thank you for joining. It's been wonderful starting this podcast with you. It's been a very long time since I have actually recorded something, so I was very self-aware and conscious when I was doing that. I think because you have you just got used to attending a lot of meetings, so it just came naturally to you.
Yeah.
But yeah, I think with the coming episodes I'll get better at this. But thank you for joining in. And we'll see you in the next one. Thank you so much.